So first one is our lens induced glaucoma. As the word suggests, the lens, which is usually a hypermature or a intumescent lens, which is causing the increase in intraocular pressure. Now, how it does is that first of all, the classification can be open angle or closed angle. So in the open angle, we have phacolytic glaucoma and phacoanaphylactic glaucoma. In closed angle, we have phacomorphic glaucoma and we can have microspherophakia or lens dislocation in anterior chamber. Now let us learn about them one by one. So first of all, phacoanaphylactic glaucoma. Let's say what has happened is because of some blunt trauma or injury to the eye, the sequestered antigens which are there in the lens, they are now in the anterior chamber. Okay, now remember, I told you when we were discussing the lens that lens contains sequestered antigens which are bounded by the capsule. Now these sequestered antigens now are there in the anterior chamber and they basically do a anaphylactic reaction which causes cells, flare as well as trabeculitis, which causes increased intraocular pressure. This is called phacoanaphylactic glaucoma. The next type of glaucoma is phacolytic glaucoma. Now what happens in a phacolytic glaucoma? Though there is no trauma to the anterior capsule, but because now the lens has become hypermature, so through these micropores, there may be a very small amount of leakage in the anterior chamber, and this leakage then basically causes the inflammation. Okay, and this inflammation then basically causes the same cascade of reactions which causes a glaucoma. Okay, so how would they give a question? They would give you a question where there would be a clinical scenario like a 76-year-old male presented to the OPD with hypermature senile cataract with deep anterior chamber and cells and flare with increased intraocular pressure. What is your diagnosis? My diagnosis here becomes phacolytic glaucoma because there is a deep anterior chamber. Now we come to the secondary angle closure glaucoma. Now there is an intumescent lens and this intumescent lens is pushing the iris forward. Okay, this intumescent lens is pushing the iris forward. Now this is obliterating the angle. This is obliterating the angle, and this type of glaucoma, this is a secondary angle closure glaucoma. Okay, so how would they give a question? They would give a question again like a 76-year-old male with mature intumescent cataract came to the OPD with very high intraocular pressure and there is a shallow AC. Okay, So as soon as the word comes shallow AC, shallow anterior chamber, your diagnosis then would be phacomorphic glaucoma. Okay. Then the next is lens dislocation glaucoma or microspherophakia. So in some conditions, or there may be a trauma, the lens comes in the anterior chamber, and because the lens is in anterior chamber, now what it does is it obliterates the angle. Okay, so this obliteration then again causes a secondary angle closure glaucoma. Similar is when there is a very small lens. Now this very small lens can basically come and cause a pupillary block. Okay, this is called microspherophakia. So microspherophakia can also then cause a secondary angle closure glaucoma. So these all are the lens induced glaucoma. Now comes what is the management. Remember, whenever we talk about the lens induced glaucoma, the first thing that we do is we decrease the intraocular pressure. By the help of anti-glaucoma medications, we can give topical or oral or systemic anti-glaucoma medications. Plus, if needed, let's say the patient is having a uveitic component in the phacolytic or phacoanaphylactic glaucoma, patient is having uveitis as well. So in that cases, we would add topical steroids. But the definitive treatment, please remember, is the lens extraction. Okay, so unless otherwise you remove what is the cause of this glaucoma, the cause of this glaucoma is not decreased outflow from the trabecular meshwork initially. The cause is because of the lens. So you have to do a lens extraction by a small incision cataract surgery. Some experienced surgeon may also basically go for a phacoemulsification surgery or even ECC or a ICC in extreme cases. So you particularly have to do a lens extraction. If even after this the intraocular pressure is not controlled, then you can go with the trabeculectomy surgery or basically combine them as well. Okay, so this is the management of lens induced glaucoma. So the primary management here is your lens extraction.